The EHOB Position Perfect Uncovered Wedges are an effective single-patient use solution designed to offload the sacrum of patients who cannot reposition themselves in bed. The 30-degree angled Position Perfect wedges are engineered with polyurethane immersive foam that contours to the patient's body while effectively maintaining a natural side-lying position. Prior to turning and repositioning a patient, first, lock the wheels and lower head of bed to ensure it is at a comfortable waist height for both caregivers. The caregiver on one side of the bed lowers the bed rail and grasps the standard sheet. He or she hands off the sheet to the caregiver on the opposite side while gently rolling the patient. Place the first Position Perfect wedge just above the waist area and the second just below the hip area to offload the sacrum. Return the patient down onto the wedges to maintain the recommended 30-degree side-lying position. The Position Perfect wedges are properly positioned when you can slide your hand between the wedges to verify the sacrum is offloaded. Adjust the head of bed to the desired angle. To remove the Position Perfect wedges, first remove the wedge just below the hip area and the second just above the waist area.